this is Dr. Parul. I am Associate Professor at Vallabhbhai Patel Chest Institute. So there are various drugs that are available for the treatment of TB. Particularly for drug-sensitive TB, we have 4 drugs, namely isoniazid, rifampicin, ethambutol, and pyrazinamide. There are various other drugs also available. To name few: linezolid, clofazimine, bedaquiline, delamanid, fluoroquinolones, and many more. As far as from where you can get them, so you can get the drugs from the nearest DOT center. Once you are diagnosed with tuberculosis, you can approach the nearest DOT center to get the drugs. Why long duration is required? See, for the treatment of tuberculosis, basically there are 2 phases. One is the intensive phase and the other is the continuation phase. In the intensive phase, we give 4 drugs, and the main purpose of this intensive phase is to kill the rapidly multiplying bacteria and hence avoid the development of resistance. Then comes the continuation phase. In the continuation phase, we give lesser number of drugs for a longer duration, and the purpose here basically is to take care of the persisters and hence prevent the relapse. That is the main thing. So to understand why multiple drugs are required, we need to understand what is the rise and the fall phenomena. See, what happens is that if only a single drug is being given for the treatment of tuberculosis, now the bacteria will be killed by this drug, but at the same time there will be emergence of the mutant strains. And after some time, these mutant strains will increase in number and there will be a rise in the number of mutant strains. And hence multiple drugs are required to stop this rise and fall phenomena. An example would be, if we are giving say 2 drugs, then what happens? The bacteria that are resistant to drug A will be killed by drug B, and the bacteria that is resistant to drug B will be killed by drug A. So that is the main thing. That is why multiple drugs are required for the treatment of tuberculosis. My message to TB patients would be, when you are diagnosed with tuberculosis, approach your nearest DOT center for treatment. And if you face any problem with the drugs, visit your doctor. Don't stop the treatment early. Don't stop it on your own.